Hello, everyone. My name is Kemi Oshandina, and I am the Associate Director of Health Equity and New Partnerships at Bristol Myers Squibb. In my current role, I am responsible for supporting the implementation of BMS's health equity patient advocacy strategy and relationships across all of our BMS therapeutic areas. At BMS, we're working hard to help address some of the toughest healthcare challenges in underserved communities. We're proud to support organizations like Black Health Matters, who are doing just that. And we're excited to present today a little more of the work we're doing and share some resources for you. So our presenters today are both on our patient access and support services team. So after a physician has written a prescription for a patient, their team is responsible for educating that healthcare provider's office around patient affordability programs that BMS offers for eligible patients. Alma Howard is the Senior Director of Patient Access Support Services. During her 30 years at BMS, Alma has worked in various market access roles. She was an advocacy health alliance liaison focused on disease areas such as rheumatology and oncology. And she has held numerous sales and leadership roles throughout her career. Rashida Taylor is the Southeast Region Director of Access and Reimbursement. Her region spans Florida to New Mexico, and her team shares a united purpose to help support access for eligible patients on BMS medication. Rashida has also been with BMS for 17 years and has held various positions in sales, legal and compliance, operations, community affairs, access, and reimbursement. I'd like to personally thank Alma and Rashida for taking the time to prepare a really informative presentation for us all today. And with that, I'll hand it over to Rashida.
Thank you so much, Kemi, and thank you for having us with you all today. Our agenda will cover a couple of key elements as we spend the next few minutes with you. We'll start with a discussion on why health equity matters. We'll transition to patient resources. And then lastly, we'll talk about the BMS commitment to health equity. So let's start with why health equity matters. The discussion on health equity has become increasingly important in our society today. There are several key factors that can contribute to the disparity in this space, particularly centered around structural and interpersonal challenges. For example, across the country, racial and ethnic minorities may experience higher rates of poor health and disease in a range of health conditions, such as diabetes, hypertension, obesity, asthma, and heart disease, when compared to white counterparts. There is much work to be done to bring more balance and equity to American health. So what is health equity? Health equity means that everyone has a fair and just opportunity to be as healthy as possible, separate from life expectancy or access to health services. And when we talk about health equity and going a little bit deeper, health equity is complex with multiple components that include health disparity, health inequality, and health justice. Let's take a closer look at these three. Health disparity are differences in health outcomes between two or more groups. Health inequality are health variations between individuals regardless of their social group. And lastly, health justice are health outcomes correlated with identifiable social attributes of sex, income, and race and ethnicity. When we specifically apply all these definitions to the impact that the lack of health equity has had on the Black and African American community, there is a clear opportunity identified where we can say there is still so much work to be done. Disparities can exist at all stages of a patient's engagement within the healthcare system. Right now, there are numerous disparities across the entire healthcare system, from risk factors for disease, to timely screening and diagnosis, to follow-up with specialists, to high-quality care. Black and African Americans appear to be at a disadvantage. As we can see on the slide here, in the risk factors for disease, Black and African American men are approximately 30% higher than white men. The incidence rate for Black women is roughly equal to that of white women. How timely screening and diagnosis is a true part of this, where we can more likely have advanced disease as Black and African Americans than white African Americans. And also data that supports our need to follow up with specialists to ensure that we get that high quality care. There are countless examples of health disparities in the United States. Let's look at some of the statistics that demonstrate examples of healthcare disparities within our populations. 43% of US adults aged 19 to 64 were estimated to be underinsured in the first half of 2020, which means that their insurance company coverage was inadequate. Among people of a racial or ethnic minority, 40% of Latinos and 24% of Black and African American business workers, people with low incomes, and young adults reported being uninsured in a 2020 survey, also aged 19 to 64, while similar white Americans reported a 17% rate. And there were disparities that are geographic and educational as well. For example, American Indians and Alaska Native people in Wyoming were 24 times more likely to be uninsured than white people in Washington, D.C. during the years of 2015 to 2019. Also in 2015 to 2019, the uninsured rate for those with a high school diploma was 3.5 times higher than for college graduates. Financial hardship also plays a space. This is just a snapshot as seen in 2018. Economic disparities can impact health access. Black and African Americans have less average household income and pay 20% of it towards Black healthcare premiums and out-of-pocket costs. For the average Black and African American family, that means almost $8,300 per year is taken up by healthcare costs. Among uninsured and underinsured Americans, 45% actually cite costs as the reason for being uninsured. COVID-19 has also had substantial impact on Black and African Americans. The burden of COVID-19 appears to have fallen disproportionately on the Black and African American population. While Black and African American populations constitute 13% of the US population overall, it accounted for 20% of COVID cases and more than 22% of COVID deaths as of July 2020. These disparities reflect long-standing systemic social, economic, and health inequities across sectors. And with job loss comes health insurance loss in a lot of cases, resulting in people needing alternative sources for coverage. However, these may be more difficult, especially in states that did not have expanded Medicaid eligibility upon enactment of the Affordable Care Act. In addition, to further dig into the crisis and impact of COVID-19 on Black and African American families, let's take a look at some additional elements. The US has 4% of the world's population, but 26% of its COVID-19 cases and 24% of its COVID-19 deaths, exacerbating a burden on our public health system. Data shows there is a lower number of healthcare providers located in minority communities. Even when affordable, options are limited. As a result, people may travel long distances to access healthcare, which poses its own challenge. Both issues can impact a person's ability to access quality healthcare and medications. Black and African Americans are also more likely to work in lower wage, in-person, essential jobs that it could expose them to greater risk of COVID-19. Additionally, about 50% of Black and African American households depend on one worker for income, meaning that losing a job could mean losing all of the benefits associated with healthcare. As we look at women, and as I've said before, losing a job also means losing healthcare, and the financial impact of a healthcare crisis can be devastating. About 1.5 times as many Black and African American women have lost their job during the COVID-19 pandemic when compared with white women. Additionally, Many women are not working as many hours as they would like. This includes 32% of Black and African American women and nearly 25% of all women who care for others. 26% of Black and African American women provide unpaid care to another adult, which can add to their burden. Overall, 24% of all US women report that caring for another has interfered with their ability to work. After discussing some of the statistics on health disparity, now I'd like to transition to talk about how Bristol Myers Squibb is helping to address these issues. It is critical that we understand that patient resources may be available to you. While there are gaps in health equity, there may be resources available for patients to help address certain barriers. One of the first steps toward accessing patient resources is getting adequate health care and provider engagement. Once your doctor decides a treatment is right for you, it is then up to you to understand your healthcare coverage and how that can impact your eligibility for patient support programs and other resources. From resources to we-sources, we need to build bridges to connect patients to health equity. A healthy community benefits us all. Through these initiatives, opportunities, and efforts, we are hopeful to contribute to increased community engagement. In an optimal environment, what does that take? At Bristol Myers Squibb, we have determined we need to be accountable for patient-centric approaches, strengthening our partnerships, community outreach and involvement, help with understanding the insurance process and coverage, which includes providing plain language explanations of insurance coverage for BMS medications, and providing information about assistance resources. And as we all know, knowledge is power. Consumers are being asked to take on more healthcare decision-making. As a result, plain language communications, useful and actionable resources and information access are necessary to allow patients to make more informed decisions. Becoming more engaged is a key to patient empowerment. Patients, caregivers, and consumers should all know their medications, the brand name, the generic name, the manufacturer. Access the manufacturer websites to learn more about the resources and programs that may be available to you. Talk with your care team. Many doctors' offices and hospitals have financial counselors, social workers, and office staff specifically dedicated to helping you understand these available resources, including programs that may help with the cost of your medications. Let's start with understanding our first step in this patient support program eligibility, which is insurance coverage and what that means to you from a patient eligibility perspective. Commercial insurance is private insurance and typically employer sponsored. If your employer offers healthcare coverage, it usually means your employer picks up some of your premium and you cover the rest. Often this includes having a copay or out-of-pocket cost for doctor visits, medications, and procedures. Commercially insured people may have access to patient programs from manufacturers, which may also help to lower or provide services that help navigate pre-approved processes and other insurance company requirements. Medicare, Medicaid, and VA benefits are different in that they are US government-sponsored programs. Medicare provides coverage for those age 65 and over, or those under age 65 with disabilities regardless of income. Supplement plans are also available from private companies that help cover additional costs related to prescriptions and other costs not covered by basic Medicare. Medicaid is a state and federal program that helps cover healthcare costs for eligible low-income adults, children, pregnant women, elderly adults, and people with disabilities. And lastly, the US Department of Veterans Affairs, or the VA, provides healthcare benefits for retired or separate military personnel, their dependents, and survivors. Those with federally funded medical plans are typically not eligible for copay and other manufacturer patient support programs, and it's critical to note this. So patient support programs for eligible patients already taking a Bristol Myers Squibb medication are available across the entire BMS portfolio. It's important to understand your insurance coverage and what that means for how you will access and navigate potential resources. Along with many other pharmaceutical companies, Bristol Myers Squibb offers patient support programs to help eligible patients understand their prescription coverage and resources that may be available to help them with the cost of their medications. I will now turn it over to Alma Howard to discuss how BMS is committed to health equity. Thank you.
Thank you, Rashida. That was a great overview. And hello, everyone. My name is Alma Howard. I work in the same area as Rashida does, which is our patient services team, part of Bristol Myers Squibb. And I'm going to focus on BMS's position on health equity. What is our organization committed to when it comes to health disparities? The opportunity that we have to do the right thing today and keep patients at the center of our business strategy, continuing to address healthcare inequities and address social needs to support that patient journey, which is critical to everyone's success. And BMS is very committed to diversity and inclusion and working to establish and create new research, new customers, seeking community partner networks, all to address the patients that we serve. Our key focus areas, which I'll talk more about, are increasing clinical trial diversity, strengthening our health equity work across the business, increasing our supplier diversity, which is very important, and ensuring that we increase workforce diversity within our organization. I'll start. Thank you, Rashida. I'll start with our commitment to diversity and inclusion. So for health disparities, we want to accelerate disease awareness and education programs with at-risk patients. And then we're very much focused on advocating for policies that promote health equity for all. With regards to clinical trial diversity, we want to identify and activate underutilized sites in underserved communities and address barriers to clinical trial participation. And then for supplier diversity, which I mentioned before, we're looking to increase our spend with Black, African American, and other diverse-owned businesses. And last, our organization is very focused on workforce representation, right? We want to achieve gender parity at the executive level, both here in the United States and globally, and double the executive representation of both Black, African American, and Hispanic Latino employees in the US by the end of next year, which is an aggressive goal, but very much doable. So Bristol Myers Squibb recognizes the importance of addressing affordability barriers for patients' access to our medications, to your medications, right? So one initiative is to increase the number of diverse patients included in our clinical trials. So about 40% of the US population comprises of people of a racial or ethnic minority. However, unfortunately, about 80 to 90% of clinical trial participants are white. So that's a pretty impactful statistic if you think about that. And there's a lot of reasons that, you know, as you think about that statistic, that this could be happening. And those could include things like diversity requirements only pertain to the National Institute of Health Studies. And those studies comprise about 6% of clinical studies in the nation. There's also a fear of discrimination by medical professionals, and there's also a lack of patient access to the specialty care facilities that recruit those clinical trial participants. And quite honestly, there's distrust amongst the community due to perceived past unethical medical testing. So we're working towards connecting patients to health resources. And I'll start with the Advocacy Exchange because this is a really important platform. This is a group of folks that are very focused on their mission. It's a 24/7 virtual platform that connects advocacy groups, patients, and industry leaders in a collaborative community. The group focuses on meaningful change initiatives, which include health equity, right? Racial and ethnic health and healthcare disparities is a critical focus. Health equality, which is patient access to care. And then they're focused on ensuring that the voice of the patient is heard and patient-focused drug development. With regards to Study Connect, we are recognizing the need for more diverse clinical study participation, which I mentioned earlier, right? And helping to recruit patients that may be underrepresented in our clinical trials. And again, based on the statistics that I just shared, that's also critically important to our future. And then last, I'll address our patient resource connections. This provides patients with resources at your zip code level and provides regional and national support options for patients. These resources are not only healthcare specific, but vary across a wide range of areas. They include things like, transportation needs, nutrition resources, and a lot of other services that may provide assistance and support to our patients. And for our employees at Bristol Myers Squibb, we have an internal commitment to embrace the voice of diversity reflected in our own employee population, right? We place a strong value on these insights, recommendations, and the influence of those across a wide range of diverse populations that bring their expertise and passion to the office every day to work on behalf of patients. We understand that the work we do at Bristol Myers Squibb is critically important, and we always keep patients top of mind. We work intentionally to define, to embrace, to embed, and to demonstrate our commitment on an ongoing basis. And this slide represents some of our internal committees that work towards that goal of diversity and inclusion and keeping the patients at the center of everything that we do. This slide is a direct quote from the CEO of Bristol Myers Squibb, Giovanni, and it says, "I believe a patient's zip code should not prevent participation in clinical trials or access to these medicines." And think about that for a moment, right? So we at Bristol Myers Squibb have a deep and strong commitment to helping achieve health equity for all members of the community. We're accelerating efforts to reach at-risk patients every day and building partnerships and outreach programs to help broaden inclusiveness. We've come a long way, but we know we have a long way to go, right? This is not a one and done deal. This is not a short-term commitment on our part, and our work is going to continue for years. And Kemi and Rashida, thank you again. We appreciate the opportunity to discuss the importance of health equity with each of you. As a reminder, your healthcare provider, your physician, makes the most appropriate clinical decisions for you based on your individual circumstances. However, as Rashida talked about, please follow up with your doctor directly and your care team directly. Ask them questions regarding your specific situation and what resources may be available to you. So again, thank you, everybody. It's great to join you today. Thank you to the Black Health Matters organization for inviting Bristol Myers Squibb to join you today. It's a great event. Thank you.